All right. So welcome to Sidra Mahmood. Sidra is a senior policy analyst at the Federal Government of Canada, working on leading open data releases for Canada's fourth largest government department. Sidra is also a passionate civic tech enthusiast, if I can speak, with a love of building beautiful client-centered products that give people more of their day back. Come on up, Sidra.
Testing.
There will be 1 second while I get the other thing full screen.
Can people hear me? Is this doing the thing? Okay. Wow. So exciting. Amazing.
Oh, yeah. Screen sharing is not sharing the right screen.
Let's not show them my notes. Those are private. It's a lot of like what not to say.
So that.
Yeah, you got the right screen on.
I'm just making sure that it's okay.
Okay, sweet.
All right.
Let's see if that works. Okay, amazing. Hi, everybody. I'm Sidra. It's so nice to meet you. I was here last week. I've been to a couple of Civic Techs over the last couple of years, but it's been a little while. And I'm here today to talk to you about crowdsourcing care and how to solve healthcare access challenges with open data. So first off, here is me. So I'm currently the Open Data Lead at Employment and Social Development Canada. If you don't know what that is, that's fine. That's actually Service Canada, so EI, old age security, pensions, all of that. I need to really state clearly that I am not here in the capacity of my employer today, so nothing that I say reflects their perspectives. And prior to that, I was with the City of Toronto's Open Data team. I was a front-end developer and the UX designer for the portal, if you've used open.toronto.ca. And then after that, I was with Code for Canada as one of their fellows, and that's kind of how I ended up in the federal government. So that's what I do. I do government. I never ended up making it to the province. I kind of skipped a step. But incidentally, I had a meeting today with the province open data team at my day job, and I couldn't talk about this. So this is very fun and very confusing for everybody. A lot of the work that I do is at the center, like the intersection of civic tech, service design, social good, and public policy. I've been designing products for agencies for over 15 years. And a lot of my work, I have that privilege where you've made it far enough in your career where you get to kind of pick the kind of stuff that you work on. And so I try to make sure that the things that I work on reflect my values, which you'll hear all about pretty shortly. So today's chat really is going to be about the experiences that I've had and then the observations that I made that resulted in the development of the app that I've developed called Fern. Before I show you Fern, I'm going to show you all of kind of that problem space that really inspired me to put it together. We'll talk about all the different considerations that come in. We'll talk about how governments are really over-dependent on technical solutions without actually addressing like the core root of the issue sometimes. I always like to add this addendum. I worked in the private sector as a designer for a long time, and the problems are very different of design in the private sector versus the public sector, because in the private sector, you're trying to keep clients on-prem as long as possible. You're trying to get them to engage and stick around. And in government, we want the opposite. Like, we want you out the door. We want your job done. You shouldn't have to spend 3 hours applying for benefits or doing a government thing or renewing an ID. Like we love you, but we don't want you here. Like, please just leave and move on with your day. So it's like a really different approach that we have to take in government, which is kind of what informs a lot of what I do. So I'm a complainer. I wouldn't be a good designer if I wasn't a good complainer. It means that I really like to find things that just aren't working. I also happen to have really bad luck. So a lot of my life has been transformed by the bad luck I've had paired with the opportunities I've had in government to fix some of the problems that have made my life difficult. But before I start there, I'm going to start with my dog. So I want to talk about my dog Winchester's journey accessing healthcare in Ontario. In 2021, we moved to the suburbs for a little while, and I called up my vet and I said, hey, we're moving. We can't see you anymore. I don't know how to drive. Can we get the veterinary records transferred? And they said, no problem. And then within the day, all of his veterinary records were transferred. It was an electronic record. It's standard. The US and Canada all kind of support the same, like rabies vaccination records and all of that. There were automatic notifications that I was receiving to update my dog's vaccines, rabies, what have you. I got a full list of available appointment times, regular standing appointments that I could book. And it's kind of that continuation of the care that my dog has been receiving, because what am I if not a bank account to fulfill my dog's desires in life? My experience accessing healthcare, however, has been very different. So in 2021, I moved to Mississauga, and I tried to get a family doctor because I have chronic illnesses and I like to have that support. But they said, well, you need to deregister with your provider. And I said, okay, that's fine. How hard could it be? It is a paper-based, mail-based process. You got to make sure you live at the address that you registered on your OHIP card. I lost my health card because I have ADHD and I'm really good at losing stuff. I tried to renew it 3 times in person, but to be fair, it was the pandemic. So I would show up and they're like, oh, our offices are actually closed, or oh, I took so many buses. I ended up moving back to Toronto in 2022 because I could not last in the suburbs as a non-driver, surprise. Ended up on a bunch of wait lists. I ended up calling over 150 providers trying to find a primary care provider. I got 3 callbacks, and I'm not lying, they've all ghosted me. So I signed up for Healthcare Connect, which I'll talk about, which is what the province and the Ministry of Healthcare long-term care provides as a service to help Ontarians find healthcare. I'll tell you about my experiences with that in a sec, but as it stands, it's been 3-ish years I don't have a family doctor. So I overutilize walk-in clinics because that's efficient. I'm not alone. Like, yes, I am an idiot. I lose my health card a lot more than I should, but I'm not alone. Over 1.8 million Ontarians lack a family doctor. It's about 15%, which is actually pretty significant. Sidebar, I did my undergrad in public health, so I care quite a bit about this stuff, even if I'm never going to use my degree. Having people who are chronically ill in our communities, people who are in vulnerable communities, and especially people who are experiencing chronic healthcare side effects, especially from things like long COVID, that number is even higher in their inability to access timely primary care. And as a result, it's a strain on emergency services, ERs, and walk-in clinics. Every single person that goes to an ER because they have strep throat, like, that's somebody who doesn't have a primary care provider who's available to give them timely care. And so I'll just talk about what's on offer, because again, I'm that person that I never build anything without fully cohesively understanding the problem space. And so Healthcare Connect is a service that's offered to people in Ontario. If you have a health card, it's a provincial service that will help you find a care provider. And the way that it works is that you call, you register online, or you call. They'll connect you with a care connector, and that is a human. I think it's typically a nurse. And what they'll do is they'll find resources. I'll be honest with you, they are doing the same Google search that I was doing. And then eventually they will call patients and they'll say, hey, here's a list of providers in your area that you can call. It's up to you. Some of them may or may not be accepting patients, but feel free to try. And how effective is this? I want to know when you're doing this for every single patient separately. So it's a bit of an outdated process because Healthcare Connect doesn't provide you real-time data on which doctors are accepting patients. A lot of the information is outdated. So if you've ever been in the seat of having to call multiple clinics and trying to say like, hey, are you taking patients, or getting the voicemail, or waiting for callbacks, or waiting for intake, or being told you're not in our catchment area, like, it's a nightmare. I hate cold calling, so it's even worse. And it's a lot of like manual matching. So they're trying to find areas where you might have clinicians, that might match. And it's a lot of work that I sincerely feel that we could do ourselves as kind of people. And then a lot of users report significant delays in being matched with the provider. It does work really well for some people. It does not work well consistently. And that's kind of a key piece of a government service. And so, there are a lot of other issues at hand as well that play into this, which is why it is important to understand the problem space. So you're not just like attaching a technical solution and then that solves it. If you go on my favorite place in the world for people to complain, Reddit, you'll see a whole bunch of folks talking about, hey, I've been waiting 9 years. I've been waiting 4 years. You have your fair share of people who are like, well, I waited 10 minutes and it was fine and it was great. Good for you. Congratulations. When we talk about service design, we're actually talking about the gaps, and we're talking about the people whose needs cannot be fulfilled. Like, that's really important. Like, I'm so glad it worked out for you, but I care about the people who are not able to fill these gaps. And frankly, I'm confused at why I, like a relatively able-bodied English-speaking person, also cannot fill the gap for myself. And so, read a lot about this kind of observational research about people talking about the barriers that they've had and how the system just doesn't work for them. And then, looking into the policy side of it, if you go onto the online register of physicians and clinicians, you'll note that they specifically tell you they will not include the information on whether a physician's accepting new patients, and then a whole bunch of other stuff that makes a lot of sense under the Privacy Act. Like, I don't need to know their personal home phone number or address, but any of kind of that ongoing investigation stuff, that stuff's fascinating. If you love reading like narky reports, I can't recommend enough reading like the physician wrongdoing reports. They're really, like, if you like true crime, they're pretty interesting. But The problem here, though, is that this is a growing problem because the College of Physicians in Ontario is predicting that in approximately 1 in 4 Ontarians are going to have a hard time finding a family doctor within the next year or so. And that's pretty disturbing. And so the point that I want to make is that, like, you can't solve every problem with civic tech. You know, I did my research. There are a lot of problems with why Ontario's healthcare is in the shape that it's in, right? Like, family doctors don't make as much as other specialties. There are spikes in retirement. There's a cost of operations. I watched a couple of CBC documentaries on what it's like to run a family practice in Ontario. It's really hard. There's a lot of paperwork and administrative work. There's a lack of data exchange. There are limits to continuity of care. Everyone's doing their own thing. And there's no standardized database of who is accepting patients. So in developing my solution, I said, I can't solve all those problems for you. I really can't. But what I can do is look at one problem. And I'm a big believer in service design of, like, if you can't fix the problem outright, manage people's expectations, help them plan around it, and just make their life a little bit easier. You don't need to change the entire thing. And so in this case, I decided to focus on, okay, well, what would it look like if we had a standardized database of the doctors who are accepting patients? Very quickly, I want to highlight governments. As somebody who's worked on a number of levels of government, we're really good at data collection. We're great at infrastructure. We have that enterprise level reach. We have the funding for it. We can operate within large systems. We can get all this data. We can get all this information. But when it comes to building solutions with all that data, we're not the most efficient at it. I'm not naming names, or I can, but there's just many examples of solutions in government where they're meant to kind of support people with the work that they're doing, and it's just maybe not worked out in the way that we expected it to do. That this can be a subject of a whole another talk, but just to say that maybe we shouldn't put the onus entirely on government to provide us the data, the regulatory mechanisms, as well as the service delivery and design. And so here's where the magic of the civic tech community comes in. So I want to introduce you to Fern. Fern was built 2 weeks ago. I'll share the URL later. And the point of Fern is it's a way for folks to find family doctors in Ontario who are actually accepting patients. It's not fancy. So very quickly, technically, it is just a really simple bare bones WordPress instance on a private server, my private server, so it doesn't have its own domain name yet. It is a completely open source WordPress custom theme. So if you lived somewhere else and you were like, hey, I want to make this, just steal my code, use it. No attribution needed. I don't care. It's HTML, vanilla bootstrap, CSS, PHP. It's responsive. It's really bare bones. The only special things I did was we created a custom post type for clinics and physicians. So you can say add clinic, and then the UI is really easy. And then there's a form that submits draft records. So if you want to recommend a doctor or you're a clinician, you just fill out the form. It'll make a draft, and then whenever I get around to it, I can review it, call to double check that you are in fact accepting patients, and hit yes. The one thing I want to stress is, though, it was built in a day, did not take long. I think it was 2 hours. I was watching Jersey Shore at the same time. Like, it was one of those days where I was like, I want to make something. It's not fancy at all. It's like 3-page templates. And the really important part of this is the data core of it. There's one database, and all it is it's a really simple table. Each record gets an ID. Each record has a provider name, which is the title of the record. That could be the name of the doctor or the clinic. We've got the city. We have a standardized address that links to a map on Google Maps. And then we've got the postal code, or the first 3 digits. How to register, which is manual, and then whether they're accepting new patients or not. If they're not accepting patients, they're not on the list. Like, simple. And then if they are at some point, we'll reactivate them. But the point of this is not to be complex. The point of this is within 3 minutes or less, you should know whether you can find a physician or not. Now to talk about how inefficient it is. How it works is that people submit practitioners. It goes into an approval queue. I get anywhere from 15 to 30 a week. I spend what little free time I have as a busy mom of 2 dogs calling up these practitioners on the weekends or on weekdays on my lunch break, just to see if they're accepting patients or not, because there's no other way to tell. And then I remove providers if they call me and say, please don't put us on your website. That's fine. So far, so good. Is it working? Okay, so I got this message from a friend of mine who's relatively a newcomer to Canada. And she just said that she has been looking for a family doctor for over a year. I work in data. I know that anecdotal evidence isn't evidence, but good enough for me from a service design perspective. If I can help one person who's had a really hard time finding a critical government service, my job is done, and I'm more than happy with that. And so, like, does Fern solve the problem? Absolutely not. It doesn't. It's just a platform. It's just a tool. Is it efficient? Absolutely not. I don't like doing it. I like building stuff. I don't like maintaining things. Luckily, I have some volunteers now. But I think open data is where, you know, we could save the day. We could fit the gaps that we need. And so ideally, if the province would just release a live data set or an API that had information on which clinicians, first they record, but also share which clinicians are accepting patients, patient capacity, and even geo coordinates of clinics, then you could just feed that right into Fern, and then I wouldn't have to do anything. You know, public and industry would step in to build solutions, and you would have like collaborative implementation of these things. And I want to stress, like, the public is really good at improving services when government shares good data. Here's some really good examples. The Waste Wizard City of Toronto uses open data to tell you what you can throw in which receptacle. Ways, you know, for wayfinding, uses municipal transit data, and PulsePoint, it uses emergency data, open data, to match cardiac incidents with people who have training in CPR. So it's a lot that we can do for our society. And other parts of the world are doing this already. So I know everyone's like, Estonia is doing it. They have a national e-health record system. It integrates real-time appointment scheduling for doctors. It tracks who's accepting new patients. Denmark's doing this, Germany's doing this, Singapore's doing this, South Korea's doing this. Please, Canada, can we not do this? And so in terms of what's next for Fern, time, I don't have the time, but if I find friends to help, that's great. I'd rather find really powerful policy friends to like change policy in the province. It turns out things have changed since I was doing web development a couple of years ago, but it turns out now you need money to pay for geolocation coordinate matching services. So anyone wants to donate to that, that's cool. Lack of data. So a lot of people have said, what about AI? What about machine learning? All this. I'm like, what data do you want me to do this with? So until we have a sufficient amount of data, we will not be advanced. Like, you don't need a map if you've got 20 data points on it. And so, you know, we'll build and we'll expand what the offering is as we get more data points, because then it'll be more meaningful, and we'll know that people are actually using it. And that's why the filters are really simple right now. We could make them more complex. They don't need to be more complex right now because we just don't have enough data points. I've got 26 records right now. A lot of people have asked about monetization, because you cannot talk about products you've built in tech without talking about monetization. Absolutely not. Healthcare is a human right. It's a core part of Canadian values. It's an investment in community. It took me a day to build. Why in the world would I ever want anyone to charge money for it? I'm one of those weird people that believes that you will not go to the grave with any of your money. So I'd rather look at what my social impact looks like while still sustaining my community. Not everybody has to feel this way. This is how I feel and how I do my work. And then, you know, a lot of people have talked about things like mapping. I just talked about that. So in terms of what you can do to support Fern, number one thing is, if you can vote in the next provincial election, pretty please. Ideally for candidates who are not going to eviscerate our public infrastructure, people who aren't going to privatize our healthcare system, because a sneaky trick people like to do is really ruin the public system so that all your faith goes in the private system. But I personally don't think that rich people are better than all the rest of us. So I just think healthcare should be equally accessible to everybody. So there's that. If you have a really great family doctor, have a quick chat with them and say, can I add you to this website? Cool with that. And then just like, if you have people in your life who are struggling without access to healthcare, use your privilege, use your knowledge, use what you can do and help them get healthcare, because that is a really transitional piece for a lot of people in order to contribute to society. And yeah, I can talk about this forever, but in summary, we need open data to connect the dots. We can build whatever solutions we want, but if we don't have really solid government data powering our services, we just can't do what we need to do. In closing, here's the link. And there's a little Instagram. Again, it's not super active, but I'm really open to ideas, questions, considerations, anything that you have. And with that, that's everything I had for today. Thanks.